Good afternoon, everyone. We'll start our Board of Health meeting. Thank you, everyone, for coming. Let me just say, first of all, I want to acknowledge the Medical Officer of Health and his retirement that is coming at the end of July. And there'll be many, many moments to thank him for his service and his leadership over the last years. But I'm sure I speak for all of Board of Health members in saying that he will be missed. We'll find appropriate times to fet him, not today. But I just want to say off the top that I know we will all miss him in the leadership that he has provided to the health unit. Given that you just announced it last week, I needed to get that at least off my chest. So I wanted to get that out there. Are there any declarations of interest under the Municipal Conflict of Interest Act? Seeing none. Confirmation of minutes, March 21st, 2016, moved by Trustee Chris Glover. Any debate or discussion? Seeing none, all in favor, that's carried. Also, Kristen Carmichael-Greb, Councillor, congratulations on your new baby. We're glad it all went well. That's the second Board of Health baby that we've had this term. Elisa being the other person, of course. Okay, so we'll go through the agenda and see what people want to hold. And then there are also two items that need to be added. One is 11.1, stop marketing to children, a window of opportunity. We'll hold that. We have deputations on that item. As well, 11.2, 2015 Toronto Public Health Annual Report. We have a presentation, so we'll hold that for that purpose. 11.3 is the 2015 Toronto Public Health Accountability Agreement Year-End Indicator Performance. Any holds? Sorry? Move receipt. All in favor, opposed if any, that's carried. Moved by Councillor Nunziata. HL 11.4, 2016 Student Nutrition Program Service Subsidies. Any holds? Seeing none, moved by Councillor Carmichael-Greb, if that's okay. All in favor of those allocations? We're almost broke $10 million. That's a real good investment we're making in our children. All in favor, opposed if any, that's carried. 11.5, the Board of Health Procedures Bylaw Review.
I have a question.
Is it a quick question or to be held, or can we resolve it quickly? Is it a long process or? No, okay. Okay, sure. Then let's ask it now.
Is to, I can't find it now, that council members who are not members of the board are not permitted to place items on the board agenda. So is that the procedure? Is that in the procedure bylaw now? And why would we not allow non-members to place items on the Board of Health agenda?
Jane, maybe I'll pass it on to Jane.
The clerks.
Or the clerks? Okay, great. Okay, we're going to have to hold on that just for a few minutes.
Okay.
The clerk is in the other room. Okay, so we'll go to 11.6, Toronto Public Health Operating Budget Variance for the 12 months ending December 31st, 2015. Move receipt. All in favor, opposed if any, that's carried. HL 11.7, Toronto Public Health Capital Budget Variance for the 12 months ending December 31st, 2015. The capital side. Moved by Councillor Nunziata. All in favor, opposed if any, that's carried. City Council approved City Council approved Toronto Public Health 2016 operating budget. There is a motion there from the Board of Health Budget Subcommittee. We had to basically do some, allocate an unallocated cut that we received from council, and the Board of Health's Budget Committee has allocated those cuts to two different places, and you have the report before you under 8A. Does anyone want to hold it? Or can we move the Budget Subcommittee's report? Yeah, okay, moved by Ashna. All in favor, opposed if any, that's carried. Thank you. 11.9, City Council approved Toronto Public Health 2016-2025 Capital Budget and Plan. This is for information. Move receipt by Councilor Nunziata. Any debate or discussion? Seeing none, all in favor, opposed if any, that's carried. The 2015 Performance Appraisal, Medical Officer of Health, you have that on purple paper. We've been through this before. We would need to go into camera if you wanted to discuss it. We would do that, of course, at the end of the meeting if you want to. Or we could pass it now.
Dave?
Yeah, it is.
No, but why?
Well, we are required by the Health Protection and Promotion Act to do an annual performance evaluation of the Medical Officer of Health. There's a subcommittee that was struck. We met, we did the review, and the report is, of course, before you on purple paper, and we're presenting it here. Do you want to hold it?
No, I don't want to hold it, but in light that the medical officer of health is leaving, so should we, I mean, is this, well, why would it be on the?
It's relevant for us for the next 2-3 months.
Oh, okay.
The appraisal goes backward.
Yeah.
The planning goes forward, so the appraisal is for the full year 2015.
Oh, okay.
And in terms of goal setting and setting the benchmarks for the appraisal that would have happened next year, I guess that will apply for the next few months anyway, or give some direction to his work in the next few months, but.
Oh, okay. All right. That's why I was questioning it.
Yeah.
Right?
But the appraisal is based on last year's, that's right, goals for which were established in the winter of 2014/15. Okay, so there's a recommendation there before you, moved by Councilor Nunziata. All in favor, opposed if any, that's carried. Okay, so do we have the clerk for the other item?
2 items.
Yes, I need to add 2 items. One is around the hiring process for the new medical officer of health, and the second one is around the student nutrition program and private schools. So, you do have it in front of you. I need a motion to, and I'm happy to move it, to introduce these 2 items. Then we'll just hold them till the end of the agenda to give you all a chance to read it. So I'll introduce the motion to introduce these 2 items. Could I get your consent? All in favor? Opposed if any? That's carried. Okay, so they've been introduced, and you have them before you. Okay, so we have 2 items plus the item. Is the clerk here for the-
Francis.
Oh, there you are. Okay, Francis. Councilor Nunziata, you had a question related to item number.
Did you call me? Francis? Oh, Francis. Hey, Francis. Hi.
Francis, meet Francis.
Francis.
Francis, meet Francis.
Okay, Francis.
11.5.
Yes. Oh.
I don't know what your
okay,
question-
I thought you knew what the question was.
She just knows the answers.
So, as far as the council members who are not members of the board are not permitted to place items on the board agenda. So is that in the procedure bylaw now, or are we recommending that we add that and not allow non-members to?
That's what's being recommended in this bylaw before you.
Okay, so why would we be recommending that? Because any other committee, councillors that are non-members of a committee are allowed through the chair to submit in placeholders on the agenda. Why would we not allow other members?
The direct correlation is actually not council members submitting stuff to its committees. It's actually, the direct correlation would be more that council members of, people who are not members of council cannot put anything on a council agenda. This is a separate board, and it would be like a non-member of council being permitted to put something on a council agenda.
But that's
They are
not
not
what-
members.
Yeah.
Members of council who are not members of the committee are not members of this body.
So it would be similar to, if I could put it in maybe a different words, the TTC, Exhibition Place, the zoo, I can't, well, except for the TTC because I'm on the TTC, but other agency boards and commissions to which I do not belong, I have to get someone on that board to introduce a motion if I have a motion. It's not like a committee of council. This is an autonomous, I think it honors the autonomous nature of the Board of Health.
But when it comes to TTC, if I want an item to be put on the TTC agenda, I go through the chair and through the staff, and it gets on the agenda.
Yes, but technically, you don't put it on the agenda.
No, I don't technically, but you
board
go through the
does.
chair.
Correct.
So is-
That's the exact same process that's being recommended here.
And so if the chair disagrees, you can't put the item on the agenda.
Well, then you could go to any other member of the board who can put the item on the agenda. It's not restricted to the chair.
All right.
Same with the TTC.
Don't agree with it, but.
Okay, any other comments on this? Should we hold it for, do you want to debate it out? You're good?
Any other members have an issue with it, then?
Anyone else want to speak to this? Okay, so the recommendations are there before you. All in favor? Opposed? That carries. Okay. Opposed, okay. You're opposed as well? Okay, great. So noted, so noted. Okay, so we have two items on the regular agenda plus the two additional items. So we'll start with HL 11.1 and then go to HL 11.2, both of which have presentations. And the first one also has deputations, but let's first hear the presentation from the Medical Officer of Health. Dr. McEwen.
Thank you, Mr. Chair, members of the board. This issue of marketing to children is something that this board has taken a clear position on a number of times in the past. The reason we're bringing it back to the board is because there is a change in the environment. We believe there's a current opportunity to advocate for measures to protect children. Just a reminder, for those who haven't been on the board that long, the former Board of Health for the City of Toronto initially advocated on this matter in 1979, and the board for the amalgamated city came at this several times. In 2008, it recommended prohibiting all commercial advertising of food and beverages to children under the age of 13, and it expanded that recommendation a couple of years later to a total ban on all commercial advertising targeted to children under 13. Following the lead of the province of Quebec and arguments that were made at the time. Most of the efforts to reduce the exposure of children to marketing have focused on food and beverages for a couple of reasons. There are some pressing public health issues associated with what children are eating and drinking. We know from our own survey of students in Toronto schools that 29% of those students, grade 7 to 12, are overweight or obese. It's also one of the major areas of marketing. A lot of the marketing that goes to young people and children is about food and beverages. We also know that parents are generally looking for some assistance in this area. In a recent survey, 85% of Canadian parents supported restrictions on marketing, particularly unhealthy foods and beverages to children. Parents do their best, we think, to try and get their children to eat and drink the right things that are good for their health. But they are competing with a very large, multi-million-dollar professional campaign that's trying to, for the most part, get children to eat things that are less healthy. In previous reports, we've provided the evidence behind this recommendation, and the evidence continues to build that marketing has an impact on children's choices and on parents' choices. We know that whether the food is healthy or not, marketing it in a professional way does increase consumption. Marketing which makes use of celebrities and children's characters, cartoons and toys and so forth that specifically appeals to children can be very, very effective. Many arguments around this issue have focused not only on the direct health implications, but also in our understanding of children's development. We know from research that's been done that young children inherently, as the American Psychological Association says, lack the cognitive capability to recognize the persuasive intent of marketing. To put it another way, young children believe what the marketers tell them. They don't recognize that it's a pitch. The Supreme Court of Canada, when it was considering this issue a number of years ago, recognized this and defined marketing directed at young children as per se manipulative. And I think their take on this, promoting products by convincing those who will always believe, is a useful way to think about how children receive marketing messages. One dimension of this issue, which we haven't flagged in previous reports to this extent, is that much of the marketing that's happening on screens, whether in the context of games, online advertising, really is also keeping people in front of screens, keeping young children in front of screens. And so in addition to whatever effect it has on food and product choices that children make and what they ask their parents for, it's also contributing to sedentary behavior, which complicates the impact on, for example, obesity. The content of marketing to children is largely focused on food and beverages, but it has a number of other dimensions which are worrisome to children's rights advocates. Exposure to highly sexualized and gendered images, violence in advert games and marketing within gaming products tends to send what most child development experts would consider the wrong messages to children about normalization of certain behaviors and sexualized attitudes, as well as promoting violence. So the notion, as the board adopted in its last time it considered this issue, that the restrictions on advertising or marketing to children should go beyond just food and beverage products is rooted in these concerns. There is a working model of this type of regulation right next door in the province of Quebec that has been in place since 1980. The Quebec Consumer Protection Act restricts advertising to children under the age of 13, all advertising, not just food and beverages. And research into the impact of that experiment, since we have one province that's implemented this policy and others that haven't, have showed that, for example, in one study, fast food consumption was reduced compared to provinces that don't have this measure, that exposure to marketing messages is reduced for children in Quebec. So there is some evidence that this is having a positive impact in the jurisdictions in which it's been tried. The opportunity that the report before you refers to press this case really has come from some signals from the federal government. The mandate letter for the federal Minister of Health, Dr. Philpott, talks about introducing new restrictions on commercial marketing of unhealthy foods and beverages to children, similar to those now in place in Quebec. And a recent report from the Senate on obesity made a very similar recommendation that the federal government should look at restricting advertising in a way that Quebec does. So it does appear to be part of the agenda of the current federal government, and we're recommending that the board once again add its voice to make progress on this issue. Toronto Public Health is part of a coalition, the Stop Marketing to Kids Coalition, which is focused on food and beverages. We're an active partner, and this national advocacy group of health and other organizations is proposing regulations based on a set of principles called the Ottawa Principles on Marketing to Children. There is a growing consensus that this is the right public policy direction to go when it comes to protecting children's health. One difference between the positions that the board has taken in the past and the one that is being advocated by Stop Marketing to Kids is an expansion of the restriction up to age 16, and this is based on more recent information about the vulnerability of somewhat older children, although they have a better ability to discern, better cognitive ability to discern the persuasive intent of marketing and to understand what it's about. There are a number of other factors in the developing mind and socialization of children of that age, which also make them more vulnerable than older children to the impact of marketing. So the recommendation that's before you is first to reaffirm the Board of Health's position and extend it to age 16 for prohibition on marketing to children across the board. But really, since there is momentum currently and a broad consensus about restricting marketing of foods and beverages, to focus on that as an initial step in the right direction. Thanks, Mr. Chairman. That's my presentation.
Great, thank you. Thank you very much, Dr. McEwen. We'll now go on to deputation, so hold your questions. We'll get to you. Don't worry, Councillor Burnside. We have 5 deputants. Florentina Stanku Soare, Stop Marketing to Kids Coalition, followed by Elizabeth Holmes, Stop Marketing to Kids Coalition as well. I'll invite the 2 of you first, and then there's 3 others as well. So the general rule here is 5 minutes, and I kind of signal at around 4 minutes and a half, and that's me trying to be orderly rather than being rude. Welcome. Are you going to go together? Great. And there's a button in front of you that you want to press, and pull the mic a little bit close to you.
Hello? Thank you. So good afternoon. My name is Elizabeth Holmes, and I'm a health policy analyst with the Canadian Cancer Society. And I'm actually joined today by Pat Vanderkooy, who is the Public Affairs Manager of Dietitians of Canada. It's up, okay. And we are representatives of Canada's First Stop Marketing to Kids Coalition. So we are on the cusp of a watershed moment in public health in Canada. Together, we have an unprecedented opportunity to adopt robust, evidence-based marketing to kids restrictions that will become the envy of the world and position Canada as a global leader in child health. On March 1st, 2016, the Senate Committee released the Obesity in Canada report. The report makes many recommendations, including a recommendation to restrict food and beverage marketing to children. We are also delighted to see that our Federal Minister of Health's mandate, as of November 2015, included restricting unhealthy food and beverage marketing to children. This legislation will have a tremendous impact on the public health of Canadians, and we want to congratulate the federal government for their leadership in restricting marketing to children. That is why 11 organizations came together to develop Canada's First Stop Marketing to Kids Coalition. We believe that children deserve to be protected from marketing practices. The coalition is focused on advocating for restrictions to food and beverage marketing to children and youth, and was launched on February 24th, 2016. The Stop Marketing to Kids website is a one-stop shop for all marketing to kids related information in Canada, such as research, related news, webinar series, resources such as Take Action toolkits. We also launched an action portal, which is on the homepage of the website. Individuals can visit the website and write a letter to their MP about restricting marketing of foods and beverages to children.
The Coalition developed the Ottawa Principles, which are meant to guide marketing to kids policy in Canada. And the Coalition is advocating, as Dr. McEwen earlier mentioned, for restrictions on all food and beverage marketing to children 16 years and younger. And that is the scope in which the organizations believed that they had a scope of practice. So it's not that we were against all marketing being included, but our scope at the time was food and beverages. We too acknowledge the increasing evidence that older children and teens are vulnerable to food and beverage marketing, as you heard earlier. The stage of brain development for older children and teens makes them highly susceptible to marketing. Older children can understand marketing but cannot necessarily defend against it, and there is increasing media use drawing them in, and they see more advertising and rely more on their peers and newer forms of marketing that influence them differently than how younger children have responded. So we're really delighted that we have, it's a full screen, but that tells you how active we've been. Since, about mid last year, we've been working on this coalition, working to come up with our common message, and we now have 27 organizations, one of which is Toronto Public Health, who have rallied around a common policy recommendation that Canada restrict food and beverage marketing to children age 16 and younger. And we think it's really fantastic that we have this milestone of one go-to consensus policy recommendation that is backed up by so many Canadian organizations. So we simply say, in conclusion, we need coordinated strategic action across the country, and together we can create a different course of history for our children and for future generations. So we're really happy to join you here today. We congratulate Toronto Public Health on your excellent work in public health advocacy, and we're happy to take questions later as well.
Thank you. We haven't done anything yet, but soon we will.
Well, you've done other advocacy, so.
Great, thank you. Hold on. There might be a question or two. Any questions? I have one. You don't have any school boards on your list of endorsements. Is that by design, or just you haven't gotten to them yet?
We focused initially on national level organizations. So obviously school boards are a little further down on the list. Toronto Public Health, you're just such go-getters. You were part of, some of your staff knew about our coalition starting up and wanted to join, and we certainly wouldn't have been opposed to municipal organizations joining in, but we did focus on national level organizations to begin with. And we really believe that it needs to be coordinated. It's great that municipalities are thinking this way, but in the end, to really get a strong policy, we'll need to have something coordinated at the national level.
Trustee Glover?
Just to follow up then, would you be interested in having school boards join your coalition?
Sure.
Yeah, okay, thank you.
Okay, thank you very much. We appreciate your input here. Next, we have Bill Jeffrey, Executive Director, Center for Health Sciences and Law. Saw Bill, there you are. Followed by Pat Vanderkooy.
That was me.
Okay,
So
sorry.
you had Elizabeth and Pat, and Florentina decided to sit in the back audience. So you've had the three of us.
Okay,
We
great.
represented the Marketing to Kids Coalition, the Stop Marketing to Kids of Canada.
Great. Okay, thank you very much.
Yeah.
Welcome, Bill.
Thank you, Mr. Chair. Does this mean I'll get 10 minutes now?
Not immediately.
So I'm the Executive Director of the Center for Health Science and Law. I've testified before this committee a couple of times before under the banner of the Center for Science and the Public Interest. The new group follows a similar kind of mission. We're nonprofit. We expect to fund ourselves with subscriptions to a new magazine, Food for Life report, and we don't take funding from industry or government. I wanted to underscore that nutrition-related illness causes an estimated 51,000 deaths a year in Canada, and is the cause of quite a lot of decreased productivity. The former federal government estimated that people who consume poor diets are 11% less productive than people who consume nutritious diets. And although this policy proposal obviously applies to children, they do become adults, and there is the worry that that poor dietary practices and physical inactivity in childhood will persist into adulthood and have some pretty catastrophic implications. Now, I wanted to emphasize the importance of physical activity, not because we think it's a major contributor to obesity, but because the evidence suggests that it isn't. But it does have other direct effects on disease outcomes. It's directly associated with certain types of cancer and diabetes and heart disease. So it is important. And also, it's important to underscore that because, as Dr. McEwen said earlier, a lot of the products, in fact, most products that are advertised to children are not food. They're products that promote sedentary play, television shows, movies, video games, and many toys that children have to actually sit down to consume. And so I want to emphasize that point. I support recommendation 1A in the staff report. And I do so because I think that advocates the Quebec model. Quebec has been a world leader in restricting advertising directed at children, and its model has been tested by the courts all the way to the Supreme Court of Canada. I do not support recommendations 1B and 2 The first one referring to basically the Stop Marketing to Children approach, which is a ban on all food and drink advertisements, and the second is the approach that was advocated by the Healthy Children's Panel, which is a ban on, and also in the Federal Liberal Election Platform, which is a ban on restrictions on nutrient-poor foods. And I do so not because I think the Quebec approach will be more protective of children, though it certainly will be, but because the other two approaches are, in my view, vulnerable to legal challenge. And I worry that if we advocate a ban on all advertising directed at children, a ban which exempts ads for video games and other sorts of screen time, and particularly bans healthy food advertising, that it won't withstand a constitutional challenge. And I think it's not responsible to assume that food and toy companies, well, particularly food companies in this case, will respond passively to regulatory change. There are recent examples of that not being the case, particularly the approach that the Ontario federal and New Brunswick governments took to restricting the marketing of flavored cigarettes. They took an approach that the tobacco industries saw a loophole in and they exploited it immediately, and I assume that the board is aware of that issue. And likewise, in the case of restaurant menu labeling, the approach that was initially advocated in New York City was challenged immediately by the restaurant industry, and the Board of Health there had to kind of regroup and come up with a new approach. And so there are some more details in my written brief about exactly how I think this argument works, but and some more information about the other models for restricting advertising directed at children in Sweden and Norway, for instance. But just to underscore this point, it's not just about advocating an approach that's going to be optimally protective of children. It's also about advocating an approach that we can be reasonably confident will sustain a legal challenge. And just from recent news on this item, there have been a series of challenges to federal legislation over the past few years that have resulted in a lot of tough on crime bills being rescinded. And in fact, one former legislative drafter at the federal government level has challenged the entire federal government's approach to vetting laws before they are approved by Parliament, and that litigant just appealed to the Federal Court of Appeal. So it's all just to say that I think we should be circumspect about what we advocate, because if we get something that ultimately fails, it's a setback for public health. Thank you, Mr. Chair.
Thank you very much. Are there questions? Trustee Glover.
So you don't recommend that we go ahead with 1B and 2. And 1B, is it because of the word all foods and beverages in there? Would you replace that with unhealthy? Would that be what you would recommend?
If I replace it with unhealthy, it would be the same as recommendation 2. So both approaches suffer from two defects. One is that when you say that you're only going to prohibit advertisements for certain types of products, and you're going to allow advertisements for all other types of products, then you deprive yourself of, as a regulator, you deprive yourself of using the argument that you're concerned about children being tricked, because you're saying essentially you don't want to trick them about these products, but it's okay to trick them about other products. So that holds companies that advertise to children to a lower standard than what they have to meet to advertise to adults.
So it's okay to trick children to eat spinach, but not to eat fast food?
Yeah, well,
that would be the argument we'd be making if we just banned unhealthy food advertising, is what you're saying?
Right, yeah.
Okay.
And secondly, because there's so much evidence, and almost every report about childhood obesity, frankly, refers to both the physical activity aspect and the dietary aspect. So a food company could legitimately say, why are you picking on us? Every single report out there, the Healthy Kids Panel report, the World Health Organization's report on ending childhood obesity, the Senate report itself, The House of Commons Standing Committee on Report, Healthy Weights for for Kids, from about a decade ago, they all focus on both physical activity and food. And to say that you're singling one of them out, I think might give grounds for a legal challenge.
What would you recommend then for the second piece, so to address your second concern?
As I say, I support the principal recommendation, which is consistent with prior
Right.
Board of Health recommendations, so I would just strike them, frankly. I don't agree with the argument that they're supported by scientific evidence. I mean, I've read the Ottawa Principles, and I agree with all of the Ottawa Principles. I just don't agree with the recommendation that is purported to flow from the principles, and I don't agree with how they've graded the evidence with these plus signs. I don't know if the board has seen that information, but.
Okay, thank you.
Okay, thank you. Any other questions? Councillor Bernstein.
I'm sure this is in the report somewhere, but how do you, when you say implement a ban on all commercial marketing to children aged 16 years and under, how do you differentiate between a child 16 and 17 in terms of your marketing?
Well, first of all, I mean, I advocate 18 because I think it's consistent with other parts of the Competition Act and with Canada's international commitments. So are you saying in terms of how it would work from a television
Well,
audience?
how does one determine, oh, this is aimed at a 16-year-old or this is aimed at a 17-year-old?
Right. Okay,
I
so
see your point of 18 or 21 because it's kind of an adult,
right.
right? But 16 is,
Yeah.
what's the difference between a 16-year-old and a 17-year-old?
Right. So the Ontario law, there's a statute called the Age of Majority Act, which stipulates that you become an adult when you turn 19. In some of the other provinces, it's 18. But so this is, it used to be on common law that you became an adult when you turned 21. And so this is an effort many years ago to reduce that, right? And in some cases, making this distinction is very simple. Like if it's school, you assume that all of the people that are attending school age K to 12 are under 18. So you don't, I mean, it's very simple.
Under 18, right?
Under 18, yeah. And other types of settings, I mean, it's maybe a little bit trickier, but it depends on the program and so forth. The way that they do it in Quebec in relation to sort of segmenting the market is they look at essentially Nielsen ratings or any of these other kinds of ratings, and they determine that a product is more, a program is more appealing to children under the age of 13, say, if the percentage of the viewing audience is higher than the percentage of that age in the population at large. So it draws more children in than other age groups. And so that's how they decide whether to ban advertising on those types of programs.
So all commercial marketing. So if it's drawing kids in, if it's a show that's they're, let's say, 13 or under, where do they advertise?
Well, lots of programs don't advertise to children, period, anyway.
But if it's a children's, sorry for interrupting, but if it's a children's program, no advertising?
Yeah, and they manage well in Quebec. And there are lots of, I don't know if you've got children, but there are lots of programs like TV Ontario, for instance, a lot of CBC programs that are targeted to that age range simply don't have any advertisements. And Treehouse, there are lots of channels that don't have them. And frankly, in the United Kingdom, the main public broadcaster there, BBC 1, 2, and 3, and 4, I think, has never had advertising, not just for children, but for adults.
No, but they have a whole different system because you pay an annual tax, right? That's a whole different system than our system here. But so if you have if it's 18-year-olds, yeah, it's cable. If it's 18-year-olds and what you're suggesting, then if the show draws in more 18 or under than it does 19 or over, there would be no advertising.
Right.
Okay, thanks.
Okay, do you have more questions, Trustee Glover? No. Anybody else? Questions? Okay, thank you very much. Appreciate you coming down. Next and last, actually, is Leslie James, Senior Manager of Health Policy, Heart and Stroke Foundation. Hello. Welcome.
I'd like to thank you for the opportunity to speak to you today on behalf of the Heart and Stroke Foundation in support of the report, Stop Marketing to Children, A Window of Opportunity. My name is Leslie James, and I'm the Senior Manager of Health Policy at the Heart and Stroke Foundation. Our organization is leading the fight against heart disease and stroke and has been present in almost every community across Canada for over 60 years. We're proud to have volunteers in every neighborhood in Toronto. We fund research, community projects, and public health initiatives across the city, ranging from state-of-the-art interventions in stroke treatment to walking school bus programs for students. And we work closely with all levels of government to encourage the adoption of healthy public policies. We've seen a dramatic reduction in death from our diseases, but we are at a pivotal moment in our work. Without meaningful action, much of what has been gained in the past few decades is at risk of being lost. Sadly, chronic disease, including obesity, has become problematic among children, showing up at younger ages and tripling in rates in the last generation. Obesity in childhood often tracks into adulthood and is associated with a magnitude of adverse health effects like diabetes, hypertension, heart disease, and some cancers. These chronic diseases shorten one's lifespan, reduce quality of life, limit productivity, and increase costs on our healthcare system. At present, 60% of Canadian adults and 30% of children are overweight or obese. The chronic disease epidemic is a societal issue, which requires a coordinated and comprehensive government response. Chronic diseases such as obesity is not simply an individual problem in which lack of willpower and knowledge is to blame. Preventing chronic disease requires intervention at all levels of society, from institution, community, to all levels of government. It is widely recognized that chronic disease prevention and control requires more than just providing information. Learning from the fight against big tobacco, we know that there are population interventions that work. Without meaningful action, we face a tsunami of chronic disease in Canada, much of which will plague our young people. We know that up to 80% of premature heart disease and stroke is preventable, but we need to transform the environments in which we live so we can enable young Canadians to live healthy lives, with particular attention to nutrition. While declines in physical activity and increases in sedentary behavior are contributors to the rise in chronic disease, experts agree that poor nutrition is the driving factor behind ill health worldwide and the leading cause of obesity. Put simply, you can't outrun your fork, and we cannot inundate children with advertising for unhealthy foods and then blame those children for wanting them. The Heart and Stroke Foundation applauds Toronto Public Health for their acknowledgement of marketing to children as an area of public health concern and an issue in which the City of Toronto can make a tangible difference now. We need to make the healthy choice the easy choice, but unfortunately at present, the healthy choice is anything but easy. The extent and pervasiveness of commercial marketing to children has reached unprecedented levels. Today, children are confronted with commercial marketing in almost all aspects of their daily life. Children are impressionable and unable to appreciate the intent of marketing messages or distinguish between advertisement and entertainment. And we know, more importantly, that marketers know that food and beverage marketing greatly influences children's food preferences. And unfortunately, the majority of food and beverage marketing, about 90%, is for items that are unhealthy, high in salt, fat, and sugar. At the same time, these messages are drowning out any healthy messages that governments, health organizations like Heart and Stroke, and parents are trying to communicate. It's an unfair fight with marketing companies speaking directly to our children and coming out on top. Restricting food and beverage marketing to kids will provide the protection our children deserve and choices for Canadian families. Our children should not be a source of revenue, and their health and happiness is not for sale. That's where marketing to children regulations will make a major difference and give Canadian families a fighting chance. Placing restrictions on marketing to kids has been deemed the most cost-effective childhood obesity prevention intervention. In fact, we've seen great successes in jurisdictions where marketing has been regulated already. The Quebec advertising ban is associated with decreased fast food consumption and decreased toy brand recognition. Quebec also has the lowest rates of obesity among 6 to 11-year-olds and one of the highest fruit and vegetable consumptions in the country. So what can the City of Toronto do in this regard? We believe the solution to addressing marketing to children requires an all-hands-on-deck approach. The City of Toronto can address marketing to children within its own purview. There is an opportunity to address marketing throughout the city, in parks, recreation facilities, on the TTC, in public libraries, and other public service facilities. The city can choose to stop using its various modes to advertise food and beverages to children. We call on the City of Toronto to take immediate action and address the issue of marketing to children by adopting policies that restrict this practice on city property. And acting on the root cause of chronic disease through this evidence-based population health approach, the City of Toronto will position itself as a world leader and ultimately make Toronto the best and healthiest place for young residents to grow up. I thank you for your time today.
Thank you very much for your presentation. Are there questions? I have one. So what are best practices around municipalities? You mentioned it a little bit at the end. What exactly are you advocating there?
Well, we look at marketing to children as a comprehensive form of marketing. So there's placement on television, which people always talk about, but there's opportunities for marketing everywhere, whether it's placement of products, whether it's sponsorship, whether it's promotion of an item, whether it's giveaways and things like that. So the city can really do is use itself as a vehicle to stop marketing to children. So if you go outside and you see advertising everywhere on billboards or on TTC, on the subways, on buses, on bus shelters, in recreation centers and public libraries, there's a magnitude of places where there are forms of marketing to children. And this can be addressed, and this is within the mandate of the City of Toronto.
Okay, thank you very much.
You're welcome.
Any other questions? Seeing none. That ends our deputations. We'll take it into committee now, or into the board, and invite you to ask questions of the Medical Officer of Health. Sure, Dr. McEwen has some clarifications to make.
I just want to share some information with the board that arises from the deputations. A matter that just came up with the last deputant about opportunities for restricting marketing to children in city venues, whether it's city-operated facilities or facilities operated by the city's agencies, boards, and commissions. The board did give us direction in the past to work with those agencies. We systematically went around to all of them to see what policies they had in place and to encourage them to put in place policies that are consistent with the board's position. And we did report in the past on the results of all of that work. So just want to let you know that much of that work has already been done. The second thing I wanted to clarify was there are slight differences between recommendations being made by different groups, and it may be helpful just to tell you or point out that the recommendations made by the Healthy Kids panel, which are referred to in recommendation 2 in the report that's before you, were about restricting marketing of unhealthy food and beverages. That's also the way the issue is framed in the Federal Minister of Health's mandate letter. It's restriction of marketing of unhealthy food and beverages. That's not something which we've recommended or the board has supported when it has dealt with this issue in the past for a number of reasons, but the position that the board adopted when it first considered this issue was all food and beverage marketing should be restricted. And when the board reviewed the Healthy Kids panel recommendations, it urged the provincial government to strengthen those recommendations to expand from just unhealthy foods to all food and beverages. A couple of reasons for that, but in the work that we did before, it was apparent that it's much more complex to implement a policy which targets only certain foods, and there's also more opportunity for manipulation in terms of drawing the line between healthy and unhealthy foods. So as a result, it's much simpler and clearer and more health protective to restrict advertising of all food and beverages. Recommendation 2 is intended to call on the provincial government to support federal efforts to restrict marketing. It's not an endorsement of the unhealthy food approach. Right, so it's just recognizing that the government of Ontario has already received advice from a panel that it set up that it would be desirable to restrict marketing, and therefore they should be on the side of the board in trying to restrict marketing. Exactly what that restriction should look like is what is recommended, what's summarized in recommendation 1, which is all marketing to children as the ultimate goal, and marketing of all foods and beverages as an initial step in conjunction with in alignment with the Stop Marketing to Kids Coalition. So I hope that didn't make things more complicated.
Great. Thank you very much. Questions of our Medical Officer of Health? Trustee Glover?
The other question that came up during the discussion was the choice of the age of 16 rather than 18. Can you speak to that?
I think that we try to follow the evidence in this matter, and at the last time we reported on this, there was good evidence that up to 13 was supported by our understanding of child development, as well as the impact of marketing on children. The evidence that's been brought forward since then, which is what the Stop Marketing to Kids Coalition is based on, takes that up to 16. We're not looking at it from a sort of a legal point of view. It's really looking at it from a health point of view. And as one of the deputants responded, the way, although we have not proposed a particular detailed implementation approach, the way this is done in Quebec is by audience analysis. Advertisers want to know who they're reaching, so almost always marketing comes with an understanding of who the audience is by age, by gender, and so on and so forth. So if the advertising reaches an audience which is more children than you would expect in the general population, it's considered targeted. The other factor that leads to targeting is the content. So if it, particularly in the case of younger children, if it's using Disney characters and things which are clearly designed to appeal to children, that's also considered targeting children. None of these measures will mean that children will never see an ad. That's not the intent of them. It's really to remove the deliberate targeting of children with advertising which is designed for that age group.
Thank you, Councillor Burnside. Questions?
Yes, thank you. So you're saying about you're looking at it not as a legal point of view, but as from a health point of view, correct?
Yes, that's where we're coming at it from.
Basically, we make a recommendation, and then it's up to the federal government to figure it out.
Yeah, the details of of how the legislation would be designed is not something that we've looked at, except like as other advocates have done, to point to Quebec as an existing working model.
And sorry, how old? What's the age in Quebec?
13.
So is there a working model for 16-year-olds?
Not that I'm aware of, not in Canada, certainly.
So so we don't really have any evidence. We're just making a recommendation?
No, we have evidence that moving up to age 16 is appropriate in terms of the health understanding of the impact of advertising. We don't have a working model of a legislation that goes up to age 16, although I'm not sure that I can think of a reason why it would be any different than 13 from the legislative point of view.
Okay. And you said Montreal kids, I think it was in one of the slides, viewed 23% less, I think it was fast food commercials or whatever it was. So it's 23, maybe it's 23% fewer commercials. I'm not sure what that number, can we pull that back up on the screen? It was in the slideshow. Thank you. So I'll move on. So you said it, whatever that number was, you said it had a positive impact. How, can you quantify that?
Well, there are two kinds of studies that have been done of jurisdictions like Quebec. One is how much exposure do children have to advertising, because if the exposure doesn't change, then it probably isn't going to have an impact, right? It has to be reduced exposure, and the other studies have looked at health outcomes, obesity levels, dietary patterns, and in both cases, Quebec has been found to have been positively affected.
But what does positive mean? Like, is it one child, or like?
Yeah. No,
I know you
studies
deal with numbers, so.
Yeah. Well, there are a number of different studies, but in general, you're looking at levels of exposure in the child. So what's the average exposure to advertising that a child of a different age might have? That's on the exposure side. Health outcomes is really...
The outcome I'm kind of concerned with, because at the end of the day, we're talking about outcomes.
It'd be obesity, in the same way that we measure, we do surveys to see what kids are eating, and we weigh them to see how much they weigh. Those studies have shown better outcomes in Quebec than in jurisdictions that don't have advertising restrictions.
Okay, so, but we don't know actual numbers, like it's not 10% better or 2% or?
Yes, we do. I put one number on one of my slides, and there's others that are in the report. We can get you others if you like.
Okay, no, I'll take word for it. And then you said fast food consumption was lower. Was that society as a whole, or was that for kids?
That was for children, and that's an example of an outcome. Okay. It's a dietary behavior that was measured.
Yeah, I appreciate that. Thanks.
Okay, thank you very much, Councillor. Anybody else? Questions? Councillor Nunziata.
Just clarification, okay, so on 1A, so the federal government is they're looking at all unhealthy food and beverages, but your recommendation is to ban all commercial marketing to children, which includes events for children, Disney on Ice, and all these concerts for kids, so you want to ban that altogether?
Yes.
You're kidding. I mean, these are events for children, so you're recommending that children not be involved, able to go to concerts or not participate in anything?
No, I think participation is not what's being recommended here. It's commercial marketing
No,
to
I know,
children,
but you're-
regardless of what the product is.
But it's not just food and beverages. You're asking for, the federal government is looking at just food and beverages, not a ban on all commercial marketing.
No, that's correct. It's any product.
So why would we recommend that? That's not what the federal government is looking at.
Well, it's true that's not what the federal government is looking at, but it is the recommendation that the board has adopted in the past, and I think the right one from a health point of view.
Oh, so you don't think it's healthy for kids to go see Disney on Ice or to see any of their characters on ice? That's very unhealthy for kids?
Well, when you go beyond foods and beverages, we're not talking about food and beverage-related health outcomes. We're talking about whether it's appropriate to market directly to children and whether they can, in fact, interpret that marketing message correctly, given their developmental stage.
So where does the responsibility of the parent come in here?
I think the parents have a lot of responsibility,
Well-
but right now, there's not a level playing field. The parents are trying their best to do the right thing for their
Well-
children, and the marketers are, with a lot more money and effort and expertise, are pushing children often in the other direction.
So why don't we
unhealthy
just
direction.
ban all marketing at all for anything and have the city? You talk about exposure. Well, what about when a parent goes to the local grocery store with their kids? So kids are going to see all the food in the grocery store. So what do you recommend, that we stop and ban all foods from grocery stores?
No, as I explained earlier,
But that's exposure. Is that not exposure?
well, the recommendation isn't to eliminate exposure. The recommendation is to eliminate marketing to children.
But it is marketing if you go into a
Councilor
store.
Enciana.
It is marketing.
As the good counselor knows, you ask the questions, and he answers them, and then you ask again, and he answers again. So you ask, and then let him answer. So ask your question, and then...
I did. If you go into a grocery store, you see signs, you see foods, you see all cookies, and you bring your kids see that. That's marketing. That's exposure. So what do you recommend? That we tell parents to keep their kids at home? Don't take them to the grocery store. Don't take them outside because they're going to be exposed.
As I said in an
Yeah.
earlier clarification, what we're recommending would not eliminate all exposure, but it will eliminate marketing which is directed specifically at children. So using the grocery store example, you're right. What's on the packages of food products in grocery store is marketing. If it's just a general audience visiting the grocery store, then it wouldn't be restricted from that point of view. However, if the products have images and cartoon characters which are targeting children, that would be restricted.
That's it for me.
Thank you. Okay, any more questions? Okay, to speak. Counselor Trustee Glover.
Yes, I'd like to propose an amendment to the motion. I've submitted it before, so I guess it can go up on the screen. So what I'm suggesting is that recommendation 4 right now includes the school boards. I'd like to remove the school boards from recommendation 4 and have a separate recommendation, which would be number 7, that would be addressed to school boards. And it addresses, so it repeats the first part. It recommends, because school boards are the avenue for approaching children, and there are often marketers and advertisers that do want to get into schools, I think it's incumbent upon school boards to be, first of all, aware of the research and the evidence on the impact of marketing to children, and also for the boards to make sure that, in Part C of my recommendation there is that the school boards review their own marketing and advertising policies to make sure that they are current with the current research and evidence about the psychological ability of children to interpret advertising and also about the health impacts.
Do you want to speak to it?
I've,
Should we support your motion?
I've sort of spoken to it, so that's, yeah. Okay.
Okay, other speakers? Councillor Carmichael Greb, followed by Councillor Burnside, followed by Stacey Berry.
I just have a few I don't believe it's the government's job to parent children. I have now 3 kids, and the one thing they hear a lot is no. So I think this is a parenting responsibility. It's not a government responsibility to regulate what needs to be marketed to children from this standpoint. I have a 6.5-year-old who watches TV and uses an iPad, but I turn it off. And if he asks for a toy or asks for food, I say no. And I'm a junk food person, so we do have junk food in the house, but he knows the difference between junk food and healthy food, and he will ask for a healthy snack. So I don't think this is something that government should be involved in. It is really a parenting responsibility.
Thank you. Councillor Burnside to speak.
Thank you, Mr. Chair. I'm not going to be I'm actually not going to be supporting this, but my reasons aren't as philosophical as my counterpart. To me, a ban on all advertising is such a blunt instrument. And I think problem with blunt instruments, there's a lot of collateral damage, and you could be damaging some positive advertising, to the point that everything starts with youth. Well, there's a lot of positive advertising that could impact on lifestyles and food choices and everything else that we'd be missing out on. So I think that's the problem with such a blunt instrument. I do appreciate the answers I got, although I think to say that parents are trying to do the right thing might be a little bit of a generous statement. Some parents are trying. I think a lot of parents could try a lot harder. And then my last concern is the age where everyone is touting the Quebec model, which is up to 13 years old. And I think it's a bit of a leap of faith to say, well, 16-year-olds, if we extend it to 16-year-olds, that should naturally be the same. I'm just not sure that that's the right approach to make that amendment or to make that leap of faith to 16 when there really isn't much evidence that I've seen today in any event that would support that. Thank you.
Thank you very much. Stacey Berry.
I have a motion, but I also wanted to speak to the item.
Yeah, absolutely. Start with your motion.
Oh, start with my motion, certainly.
Yes, it is, yeah.
Okay, so for recommendation 3 to be amended to replace government services with government and consumer services. So as you know, those 2 ministries have now been amalgamated into one. And then for recommendation 6 to be amended by also forwarding the report to the Canadian Radio, Television, Telecommunications Commission, CRTC. So in terms of this issue, I do support it because my biggest concern with this issue are the equity-seeking groups and vulnerable children who may not have the parents who can really sit there with them and guide them through what they're seeing on television. So there are some benefits that could come from this type of legislation in terms of not negatively influencing the decisions that some of these children make, especially when they do go to the grocery stores and they're constantly seeing the negative ads. So they'll say to their parent, I want this because I saw it on TV. But I have a lot of nieces and nephews, but I'm the type of person, same with my sister who's hurt their parent, we sit with them and have those conversations, but not all children have that privilege where someone can communicate with them what some of these advertisements mean. So I'm just really concerned with the really vulnerable children in terms of this issue.
Great, thank you. Any other speakers? Dr. Peter? Sorry, okay.
Okay, so I'd like to move to delete recommendation 1. Okay? And replace it, I guess I should have given it to the girls.
Usually the way it works, Councilor
Yeah, I know.
Speaker.
The Board,
Person.
The Board of Health, I request the Government of Canada to act swiftly to implement recommendations on commercial marketing of unhealthy foods and beverages to children signaled in both the Minister of Health's mandate letter of November 12, 2015, and the Senate report. So I'm moving to delete recommendation 1 and replace it with that, which is what the federal government is looking at.
Okay, usually you submit these things beforehand, Councilor.
Yes, I know, I apologize.
This one?
Okay, so I agree with Councillor Carmichael Greb and questions that were asked by Councillor Burnside. You know, sometimes I think that we go a little too far. You know, I mean, we want to help in obesity with parents that have, well, I think, personally, I think it's up to the parents to monitor what the kids are eating. But sometimes you can't because they're not always at home, right? When they're older, they're at school or whatever. But I don't think it's, for us to ban commercial ban on everything, I think is wrong. It's not just food and beverages according to the medical officer health, it's everything. And, you know, it's not our job to do that. And I think that sometimes we try to go a little too far. And there's also the enforcement of it. I mean, who's going to enforce all this? I mean, who's going to stop a parent from bringing their children into a grocery store and buying food? You know, and it's up to the parent to decide what they want to buy for their kids. It's not up to us to decide how should parent your kids. And, you know, it just frustrates me sometimes we get some of these recommendations come out of this committee that's just off the wall. And, you know, we have to just be careful if we want the government of Canada to adopt some of our recommendations, we have to be, you know, a little not too strong on the request that we're making that's not only reasonable to parents, but also to the advertisers. I mean, can you imagine the millions of dollars of revenue sometimes some of these businesses have in some of the ads all over the city? And we start banning that, then I don't know what the city of Toronto is doing, but I think we have to be a little careful on what we ask for. So that's why I'm moving my recommendation.
Thank you, Councilor Nunziata. Peter Wong to speak.
Thank you. I think what hasn't come across in the discussion is that obesity really is an epidemic situation. And in Dr. McCoon's presentation, he reports here that 29% of Toronto students between, I guess that's grades 7 and 12, are overweight and obese. You know, if we have to stand back and think about that. That's almost a third of our school kids are obese. This is epidemic. We're facing a huge problem. And, you know, the fight against obesity and living and trying to make kids live healthy and families live healthy is really a multi-pronged approach. And this is one of the prongs. So, you know, the research supports it. So I'm going to be in favor of the motion, and I hope that everybody else will be, because this is going to be a huge step forward in the fight against obesity. Thanks.
Great, thank you very much. Anybody else? Did you want? Okay, go ahead. Well, yes, we can go a second round. We have lots of time, so go ahead. Sorry, Councillor, do you have some restrictions? You do. Okay, so what are your restrictions? Just so.
It shouldn't be based on me. I follow the process.
Okay. Trustee Glover.
I just want to, this is an issue that I've looked at, especially advertising in schools, and I just wanted to throw out a few more things about it. The States is probably the worst example where they have very few restrictions, if any, on advertising to children. And it's gotten to the point where on the back of exams, there's advertisements. So when you write your midterm exam in school, you have an ad. There are over 2 million children a day who watch Channel 1 news in the States. And that includes 8 minutes of canned news and then 3 minutes of advertising. They have, in some schools, they have Coca-Cola Day, where they have all the children dressed in red and white. And then at one of the schools, they had all the children line up on the field to form the logo of Coca-Cola, and they had a crane to take a picture of them. And just before they took the picture, one of the kids took off his shirt, and he had a Pepsi shirt underneath. He was suspended. Anyway, so it's, and there's also, it just goes so far. I think it's very important that we draw the line on advertising to children. There's also a McDonald's health curriculum that's available for free to schools. And it emphasizes physical activity, but it doesn't talk at all about the need to eat healthy foods. So I think I'm very supportive of the motion. I'm hoping people will also support the amendment that I brought forward. Thank you.
Great, thank you. I'll just speak for 2 seconds. You know, this also is an issue of, are we going to be led by the research? Or are we going to be led by, frankly, others concerned? This is the right thing to do. The evidence points in this direction. We saw the same kind of issues marshaled forward around when we did this tobacco restrictions, and we pushed back on that. Around advertising and tobacco and where it's placed in the store. Maybe we'll come to that with this issue at another time, but let's at least bite off the big chunks. And the big chunks is the advertising to, frankly, children. I didn't think this would be as controversial as this hearing here this board is demonstrating. So I'll be supporting Trustee Glover's amendments because I think it strengthens and puts some onus on the school boards to do that, to do some work. But I think the motions are whole and they're good and they're the right thing to do. I saw Paul and then Councillor Cressy.
I guess my concerns and the reason I think this is getting more controversial is because I don't know if I'm allowed to make this request at this time, but to split up 1A and 1B and have them as separate votes.
Yeah,
because
we can do that.
For me, 1A is we're now saying, you know, if Barney comes and someone dresses up in a costume and goes down the street in Toronto, that's no longer allowed because that's marketing. Nike should no longer say these shoes kids should wear because that's marketing. I think to Councillor Nunziata's point, to me it feels like we're going a little bit too far. When we talk about food and beverage and all that, I'm very much on board and agree with it 100%, but I'm a little bit worried about banning all commercial marketing and how that gets defined because commercial marketing is quite a broad type of comment.
Councillor Cressy, last speaker.
Thank you, and my apologies to my fellow board members for not having been here and not staying for the rest of the meeting. I wanted to weigh in very briefly on this because I think it's one of those issues where are we trusting and looking and being guided by the research that's out there or not? And the research and our medical officer of health's report and recommendations on this are clear. Yesterday I had the chance to speak with Senator Art Eggleton, who was part of the lead in bringing forward a Senate report on this very issue. They were guided by research. The Senate of Canada's strong recommendations on this were guided by the same research that we're seeking to be guided by today. And it's for that reason that I will be supporting the recommendations. Thank you.
Thank you. Okay, we're ready to vote. There are, we'll be guided by the clerk here, 3 amendments. First amendment is by Trustee Glovers. Put them on the screen. Ready to vote? All in favor of these motions? Raise your hand because it's going to be, okay, that passes pretty well unanimously. Number opposed, just in case anyone wants to raise their hand for that. Number 2 is Stacey Berry's motions to add two other people to receive two other groups to receive the communication. All in favor of that amendment? Opposed, if any, that's carried. Number 3. It is to delete recommendation 1 and replace it with the following. All in favor of that recommendation, so indicate. 1, 2, 3, 4, 5. Opposed? 1, 2, 3, 4, 5, 6. This motion fails. The item as amended. Now, Councillor Nunziata's motion essentially did, Paul, what you asked for. It separated out the thing, so it really is the motion as amended now. Do you want to separate it out? Okay, we'll separate it out. Okay, so 1A, you want separated out, so we'll vote on 1A. If you could you put the whole motion on the agenda, on the screen? Just 1A for now? Well, you have it there in front of you, right? 1A? Okay, all in favor of 1A, so indicate. 1, 2, 3, 4, 5, 6. Opposed? 1, 2, 3, 4, 5. That passes. 1B to the new amended 7. All in favor? That passes as well. Okay, thank you very much, everyone, for that item. Okay, 11.2, Toronto Public Health Annual Report.
Thanks, Mr. Chair. I just wanted to speak briefly. This is the third formal annual report that the board has received since the organizational standards require all boards of health to produce an annual report. I'm just going to mention highlights from it.
Let's just do a timeout to let folks want to leave, so we have your undivided attention. Thank you. Sorry, Dr. McKeon.
So I'm just going to mention a few highlights from the report. I encourage all members of the board and any member of the public to read the whole report, as it's filled with great information about the work of Toronto Public Health in 2015. And I think will really demonstrate for anyone who's familiar with our strategic plan that we are making progress on the items that the board has directed us. The report contains an annual overview which talks about events and activities that happened at different points of the year. Some of the events were the Active City Forum, the 2015 Youth Summit, which focused on some of the issues that we've just been talking about. Of course, the Para-Pan Am Games was a big event in the city, and public health, as you know from an earlier report, played an important role. It mentions the measles outbreak that happened earlier this year and some important anniversaries, the 10th anniversary of the Toronto Drug Strategy, and the 25th anniversary of the Works, our harm reduction program. One thing I did want to highlight, and again, this has been the subject of previous reports, and we will be reporting back a little bit later this year on the state of the Indigenous health strategy for Toronto. This is a community-led strategy that's been supported by both Toronto Public Health and the Toronto Central LHIN. This is a picture of the Youth Council, which is part of the advisory circle. I think it's a really important connection and something that we laid out in a very explicit way in the strategic plan, that we wanted to develop a health strategy for this important part of our community. Early in 2015, we reported on progress on health inequities. Health inequities are featured in the mission of Toronto Public Health. They've been a major focus of activity in our programs and in our policy advocacy. And so for the first chance we've had to really see how unequal or equal the city is getting over time. Unfortunately, we found that we still have significant health inequities by income across the city for a number of different health outcomes. Over about a 10-year period, we're seeing, in many cases, indicators becoming worse, in most cases, not improving. So that really galvanizes us in terms of our efforts to try and close some of those health gaps. Later in the year, we brought forward a significant report, an action plan on intimate partner violence, which, as you'll recall, was inspired by the death of one of our staff, Zara Abdil, and her 2 sons. And we are now working on this strategy, which was approved by City Council, an action plan to try and do everything we can to prevent intimate partner violence. Climate change strategy was another major initiative over the course of the year. We've reported over many years about hot and cold weather responses, which are one of the features of a changing climate. But this strategy also prescribes action and work which will be played out and updated in subsequent reports to the board on factors associated with climate change which affect food availability, water, and the risk of vector-borne disease. A major set of programs that doesn't get a lot of profile at the Board of Health are the programs for young children involving preschool speech and language, blind, low vision, and infant hearing. In 2015, we went through a major reorganization and rebranding of those programs. They're now called Early Abilities. Toronto Public Health is the host agency for those programs, which are entirely provincially funded, play a very, very important role in early childhood development. We believe that the changes that were made in 2015 are going to lead to better and more equitable service access for parents and young children. I've already mentioned the Para-Pan Am Games. There are a number of different things that we did associated with the Games. We were key in securing the first smoke-free Games in which all facilities were smoke-free for visitors, attendees, and athletes, of course. Saw the launch of our second city-branded condom, Condom TO, with an athletic Pan Am theme. And of course, we had a significant health protection role in making sure that the food served at the many venues, the pools, were safe for athletes and spectators. I also mentioned something that we don't talk about so much unless you read closely the fine print in the capital budget, and that is the way we are using technology to enhance service delivery in public health. Just a few examples here. GastroBusters is an online gastrointestinal disease reporting website where people can report foodborne illness at any time. eChat was expansion of our telephone counseling onto online counseling, provide yet another way for people to talk to a health professional at Toronto Public Health, particularly for young people. We've expanded our geospatial mapping capacity, and you'll see that increasingly in reports and documents that we produce. And we have in a number of program areas implemented mobile technology for our staff, many of whom are working in the community every day, now increasingly have access through mobile technology to databases, patient records, and information back at the office without actually going back to the office, which makes us more efficient and more effective in the community. Lastly, the annual report does list a number of ways in which the organization and its employees have been recognized by external agencies. There have been a number of awards for groundbreaking reports, for innovative programs and campaigns, and these are all recognitions by people other than us of the good work done by the people who work in Toronto Public Health. So that's a highly speedy review, just at a high level, of some of the things that are in the report. Once again, I really encourage you to review the report, and I want to recognize our internal staff who did all the design and production of the report to make it look nice. Thanks very much.
Thank you very much, and congratulations on not just a great report, but on all the great work that Public Health is doing. We have a lot to be proud of in Public Health. Are there any questions of the Medical Officer of Health? Okay, in which case I'll just say thank you and ask Paul to motion that we receive the item. All in favor? Opposed, if any? That's carried. Okay, there are two other items on the agenda. One is the student nutrition program item. Oh, sorry, 11 is hiring. Okay, so regrettably, we have a job in front of us, and that is to basically select a new medical officer of health, or to recommend. Our role actually is not to select. Our role is to recommend to council who to select for the next medical officer of health. So there's a motion in front of you here. I hope you had a chance to read it in between this and that. We need 2 citizen members, and we need 2 counselors to be added to the hiring panel of myself and the vice chair. So far, 3 counselors have indicated that they want to be a part of it. We don't want to get the group to be too unwieldy, so I'll just say who they are: Councillor Cressy, Councillor Carmichael Greb, and Councillor Nunziata. On the citizen side, we have also 3 people who've indicated that they want to be a part of it: Paul Nagpal, Peter Wong, and Ashna Bowery. So unless any of you want to take your name off, then what I'm going to recommend, and the clerk is kind of ready there, is that we basically just pull names from a hat so that we have at the end of the day, we will make sure that the board is engaged as a board. Perhaps at the last interview, like, we still have to kind of work out some details for the process, but the board will be involved. It will not be just this panel that will be nominating the person. So no one's going to be excluded from any participation, but certainly for the interview piece and guiding the process, we need a more focused group. So seeing that no one's pulling their name, can you do the councillors first? Councillor Cressy. Graham. Okay. Should the medical officer of health? No, maybe not.
So the 2 names pulled will be the 2 additional counselors.
Correct. Correct, and we'll add that to the motion. Councillors Carmichael Greb and Councillor Nunziata. Okay. Okay, so now on the citizen side.
Paul Nagpal, Peter Wong, and Ashna Bowery.
Right.
So the 2 pulled will be on the committee.
Yes. Paul Nagpal and Peter Wong. So we'll add those names to motion number 1. So the medical officer of health hiring panel be comprised of the chair, vice chair, Paul Nagpal, Peter Wong, and councillors Carmichael Greb and Councillor Nunziata. And then the rest is there before you. Okay, any discussion on that as to a process? We'll get back to you on the fuller process in the days ahead. Okay, all in favor? Opposed, if any? That's carried. And then lastly, the issue of the student nutrition program. Maybe I'll give you some background on that. We had a number of us had a conversation with some folks in the private school system, and we have actually historically funded some private schools on a needs basis for student nutrition. Now that we are towards the end, not quite at the end, but towards the end of funding our 20%, which was our goal always, of the public school student nutrition program, it is time for us to think, well, there are many private schools out there. Some of them do need this support. And so how and where, that's going to require a lot of thinking. And this basically initiates the process as to how you would develop a strategy that is needs-based if we do eventually decide to go in this direction. So this gives direction to the staff to do that. Is there any debate on this motion?
Actually, could we have a little bit more information about the needs that we're seeing that are driving this motion?
There are some private schools that are faith-based where there simply are. Parents will put everything into the tuition, and even at the cost of nutrition issues for their children. Obviously, that's not Upper Canada College or Bishop Strawn, but there are, the private school system is actually, there's more than you think out there. There's over 300 private schools out there. And most of them, of course, would not even come close to qualifying, but some of them would. Some of them would. And to be fair to everyone on an equity basis, if we're doing this as a needs-based program, then they should be in that calculation. How you make that calculation, that's the work that needs to be done. But once that calculation is made and you are actually comparing apples to apples, the distinction of public-private doesn't really hold.
I'll just say that I would hate to see any child, and I hate to see any child going to school hungry, being hungry. So I'll be supporting the motion.
Okay, anybody else? Okay, all in favor of that motion? Opposed, if any? That's carried. Thank you very much, everyone. Great meeting. Oh, sorry. Last motion, that City Council, that the Board of Health excused the absence of Elisa Levy from the April 25th, 2016 Board of Health meeting. All in favor? Opposed, if any? That's carried. Thank you very much, everyone.